Welcome to Behaviorism in the Field of Social Work by Emily Kahns, Ciara Daigre, Samantha Lopez, and Jacqueline Parks. Langer and Lietz define behaviorism as follows. Behavioral theory, often called behaviorism, discusses how our actions are affected by what happens before a behavior and the consequences that follow. In other words, behaviorism is the theory that actions are affected by preceding events and the outcomes resulting after a behavior has occurred. There are two main principles of behaviorism or behavioral theory. The first is that preceding occurrences can influence an individual's behavior or actions, and the second is that consequences can also influence an individual's behavior or actions. To develop a better understanding, we're going to talk about the key concepts associated with behaviorism. The first concept is classical conditioning. Simply put, classical conditioning can be understood as a stimulus producing a response. So the best example of this is Pavlov's dogs. He rang a bell when the food was available, which caused the dogs to begin salivating. Therefore, preceding events affected behavior. The second concept is operant conditioning. Think of operant conditioning as the opposite of classical conditioning. The events that occur after the behavior or the consequences affect the behavior. The third is reinforcers. Reinforcers constitute something that occurs that increases the chances of the behavior occurring again. This is like an accolade, award, or benefit. And then we have punishers, which constitutes something that occurs that decreases the chances of the behavior occurring again. This is like a negative reaction or a fallout. Imitation, that a behavior can be affected by learning or observing. And then lastly, cognition. Cognition is the concept that an individual's beliefs can affect their behavior.
Let's look at some examples of behaviorism in practice setting. One example of behaviorism is working with a client with obsessive-compulsive disorder, or OCD. In this example, the social worker can positively reinforce when the client does not do a behavior associated with their OCD. A second example is when social workers are working with a client who is a minority and experiences anxiety when they aren't around their own culture. Social workers can use the concept of cognition to alter the automatic thoughts of the individual to help change their thoughts associated with their anxiety and improve their anxiety overall. Let's look at a couple more examples. Social workers can also use behaviorism when working with adults or children with autism. In this example, social workers can use classical conditioning to understand what happened before the client engaged in the behavior, or also known as the antecedent. The social worker can then use reinforcers or punishers to either increase or decrease that behavior. Similarly, social workers can use behaviorism when working with young children that have behavioral problems. The social worker can use either reinforcers, such as gold star stickers, candy, etc., to encourage appropriate behavior, or they can use punishers, such as taking a desired activity or toy away when the behavior is exhibited by the child.
As with all theories, there are strengths and limitations of behaviorism. I will be discussing some of the strengths. First, behaviorism is rooted in empirical research and has the largest evidence base of all practice theories used. This is a huge strength for behaviorism. Also, it is highly structured. A highly structured practice can make it comfortable for social workers to apply the practice with their clients. It can also help the practice be uniform across the board. For children, a highly structured practice can be comfortable due to knowing what is expected of them. As discussed previously, behaviorism utilizes reinforcers. If a child is displaying a positive and appropriate behavior, a reinforcer will be given. If they understand the meaning behind this, they will continue to do these behaviors to earn reinforcers. Behaviorism is also well developed. It has clear principles that makes learning and training easy for professionals. Social workers can also learn the effectiveness by observing and utilizing the practice with clients. Behaviorism offers explanations of specific behaviors and identifies related interventions that will work to address those behaviors. It can also be applied to a variety of clients. Lastly, behaviorism works well with children who are motivated by social reinforcement, whether this be verbal praise or edible reinforcers. These children that are more motivated by reinforcements are more receptive due to the nature of the techniques used.
There are a couple important things to remember about the limitations of behaviorism. The most prevalent theme was the narrow focus of behaviorism and behavioral therapies. Behaviorism is persistently focused on conditioning, reinforcers, punishers. It prevents exploration of larger systems. What's going on in the micro, the meso, and the macro? There's no room for that in behavioral theory. There's also no room for the person and environment perspective. It does not explore the biopsychosocial aspects of clients' well-being, which as a social worker we all know is our primary focus. I also heard mentioned several times the topic of subjectivity with regards to the limitations of behaviorism. First of all, the voice of the client is so important to us as social workers, we know that. So consider a nonverbal child or the autonomy of the child or adult with autism who can't speak. We're sort of really just guessing the choice of the client in cases like that, sort of imposing values sometimes. Self-determination is extremely important. As social workers, we all know that. Who's to say we should not be able to allow children or adults with autism to STEM? It's those kind of things where the imposition of values, we need to be really aware of the risk of exploitation with behaviorism. The final limitation I was able to find in my research regarding behaviorism and behavioral therapies was scientists urge practitioners to be very wary that there are medically viable treatments to consider, pharmaceuticals that are proven effective, and as always, we are urged to maintain professionalism and select all of the appropriate theories and interventions when working with our clients. It's a reminder, a great reminder to social workers to use the whole toolbox. Always utilize the most appropriate interventions.